you so much again, ambassadors, for joining Chronic Disease Solutions Awareness Month, which is October, but obviously we want to start early. It's right now mid-end of June, and our goal is basically, to prepare. The main activity, as I mentioned in one of the other videos, is really September and October for the events, for the outreach. We want to go wild and get as much attention in the media, with decision makers, governments, governors, and so on. Now, this video is about the proclamation, and which is probably, the end point, in a sense that, just think about it. If we get hundreds of leaders, governors, mayors in the US and worldwide to join and to support this, to sign the proclamation, this is going to be huge, right? It puts so much pressure on them to actually act upon it, because even after the summit in October and the Chronic Disease Month, we're going to keep going, right? We remind them, we're going to make sure that policy follows, that they start to support lifestyle-based medicine and preventive measures in healthcare. So here we go. What are we going to do with the proclamation? So if you signed up for the proclamation, that's great. You're going to get that video anyway. If not, you're going to see it also, and you can still sign up, and you can be a media partner and reach out for proclamations, no problem. Let me make this a little larger here so you can see it. So we try to make it really simple, because complicated things usually never work, and most of all, simple for you, right? So you can actually do a lot for the time that you can allocate to this. So first of all, please be 100% dedicated and confident, and know that this is really important, right? Healthcare needs to change. I think we all agree. I've never seen somebody who said, "Oh, I love healthcare as it is," right? It's perfect. No, it's not, especially not for chronic health issues. And so just be confident. You speak with your voice is supported and backed by millions of people. Most don't speak up, but they agree with you. So you have all the right to demand the decision makers and leaders to make this change, to support, prioritize, and support and invest in prevention and lifestyle-based medicine. So be confident. Also, when you write, be confident. Make it personal. If you have a personal health story, maybe add it, right, in the emails and your outreach. Share, speak up. So then make a plan. So for example, the plan could be as simple as, hey, my goal for right now is to reach one ambassador and one proclamation, have it signed. And then, and maybe the long term until October is I want 10. And think about it. There's so many you can reach out to. So I gave you a few examples. Think about whoever has decision-making power, who can influence policy and the direction where healthcare goes. So city mayors, I think they're easy, because they want, all of them want, this is a very positive thing benefiting everyone. It's not political. Please be very important. Make a statement. It's a non-political movement, right? Doesn't matter what your political or religious views are. This is not about that. It's about health for everybody. So city mayors, physicians, your physicians, tell them, hey, I want, first of all, are you offering lifestyle medicine already, prevention? But first of all, sign this. This is important. Clinics, hospitals, healthcare business leaders, if you have insurance companies or any religious, healthcare, religious, corporate, community leaders, churches, religious leaders, ask them to sign this. Proclaim, state, yes, I want prevention. I want ways, I want solutions for chronic health issues for me, my family, and everyone in this community. And then this is the easier ones, I would say, right? And then build it up. It's good probably to test a little bit, get a 1 or 2 signed up, and then go to more state, governors, federal officials, any public figure or leader or celebrity, even or influencers saying, hey, yeah, I support this. Whoever it is, we want to get thousands, ideally, and many more of these proclamations signed. And then basically you either call, so the specific steps are, and by the way, this is the proclamation, I show you that in a second. And so basically here, the next specific steps are you contact the office, you call, or ask for an appointment, or you send an email, right? However you can reach these leaders in the field. And then make sure you follow up. Like typically once is not enough. Sometimes you have to ask 5 emails and be really persistent, right? And really go for it, right? And argue why this is so important. And not always do you need to write long emails, right? Sometimes what I do, the long email, you resend it to the same address and just do the short message. Did you get this? This is really important. Can I talk to someone? Can you please reply? These kind of things. And then once you get a confirmation, the proclamation is being signed, a signature, right? You get, and typically it's on an official letterhead or a state letterhead and so on. And they change it based on the template, what they write, and then ask them to state publicly, either through a press release or in a newspaper, or record a little video. If it's the governor, for example, or somebody that works for the governor, we are okay with that. Ideally, the governor, right? But we want this to be officially proclaimed and shown, and a public statement being made. And then it's important that we share this, right? So your work and you basically, you can say basically when you go to our Twitter account, which is our main account that we use on social media. We use others too, like Facebook, Instagram, and all that, TikTok. But this is our main one because we really want to grow this as the Lifestyle Medicine Chronic Disease Month channel. So post it there with your own. I mean, hopefully you are on Twitter X already. If not, please do sign up, join us, and it's great. We can share with each other and together grow. And it helps you also to get out there if you'd like and be more known. So here's an email script or call script. You can use this, and you can change it up to your needs. Maybe you can write it even better, hopefully, and send it out and attach the Word document. Right, that's really important. Let me see here if I have the, oops, I hope I have this here. Here we go. So this is just read that please. This is the proclamation with the guidelines here on the top. So you can send this document to everybody, kind of explains what they should do and why. And this is the proclamation. I hope you totally agree with this. And again, the proclamation can be adjusted if somebody asks you, if they want to change a few things, no problem. The most important is this down here. I proclaim October to be Chronic Disease Awareness Month, and I support this, right? However they write it, that's okay, but ideally we want to keep it as it is, put it on the letterhead, and send it to you, and do this with a proclamation, an announcement. And that's really it, right? So at the end, it's really easy to do. If you have questions, go to the WhatsApp group, and we can always ask questions there. But again, to simplify, reach out as many as you can. Be tough, be dedicated, confident, say, but this is important, we need you to sign this. Which if they don't sign it, which basically means they don't care. They don't care about their citizen health, their community's health. I mean, it's really that clear, right? And I think it's okay. We step on their toes and say, no, this is not possible anymore. We as a community, if it's US or UK or worldwide, wherever it is, we want you to say, yes, I want healthy people. I want healthy communities. And increase longevity, reduce healthcare costs, right? Doctors being trained in lifestyle medicine, health coaches supporting people, because the biggest problem, as we know, is not so much we know what to do, we know what's good, like diet, exercise, and all that, stress management, but we don't do it, so we need support. 99% of us need support. We'll do a lot better if we have the support inside healthcare to help us. So thanks so much. I wish you such good luck. I mean, aim high, right? Maybe start small with a few, 1 or 2 proclamations being signed, and then go high. Like, think about who do I know? Like, who? And I know that you're gonna come up with people that you know, the decision leaders in your communities, but also big names, right? That reach a lot of people. So whoever you, small to large, whoever you can bring in to sign the proclamation. It's amazing. It's wonderful. Thank you so much. If you have questions, let us know.